My name is Tracy Cundiff. I'm an 8th semester nursing student, and today I'll be performing trach care for a patient. So what I would do first, you want to do trach care at least once a shift or every 8 hours. You want to come in and introduce yourself to the patient, get their name and date of birth, and verify that with their armband. Make sure you have the correct patient. Obviously, your patient would have a trach. Provide privacy for your patient, so pull their curtain. I'm not going to pull this curtain because my oxygen and suction are back in that corner, but you would want to provide them with patient privacy. I want to make sure that they're alert and orientated ×3, and then I would take my stethoscope and listen to their lung sounds. I want to note their rate, depth, and breathing effort and the rhythm to determine whether or not they need to be suctioned as well. And if they need to be suctioned, then we'll perform that too with the tracheostomy care at this time. So this is Opal. I'm going to raise Opal to a working height and kind of describe to her a little bit about what we're going to be doing. Especially if this is a new trach patient, this can be kind of uncomfortable and scary for them. So I would explain to Opal what we do with suctioning and trach care. I want to make sure and hyperoxygenate her, so I would turn her oxygen up. I would go ahead and turn my suction on between 80 and 120, and then let her know that she needs to take 3 to 5 deep breaths to kind of hyperoxygenate her, because I'm going to remove this oxygen from her tracheostomy while I perform care. So I also want to make sure that she has a way to communicate with me. So I'm going to have her raise her left hand if at any time she feels like she needs a break. If she's in any distress or pain, to let me know that she needs to stop for a minute. And then we can resume whenever she's comfortable. So once I've established that with her, I like to drape my patients with a towel just to try to keep secretions off of their gown in bed. I would perform hand hygiene, so go ahead and wash my hands, foam in and foam out when you come in and out of the room. But I would wash my hands. I'm going to go ahead and open my tracheostomy catheter, the suction tray, which is a sterile tray, opening it away from me. And then I want to open my sterile gloves. These kits come with sterile gloves, but I don't typically fit into them, so I usually bring a couple pairs into the room. For this procedure, you'll need at least 3 pairs of sterile gloves, so I would go ahead and grab 4 or 5 just in case I break sterility. So grab your sterile gloves, open these up. And go ahead and don your sterile gloves. And my suction is already on. I'm going to take this box out for my saline. And these kits come with sterile normal saline. I would pour that into this box for clearing my suction and for lubricating the suction catheter. And then I would pull my suction catheter out. And I like to wrap this around my hand just so I have a little better control over it. Alright, so at this point I'm going to go ahead and contaminate a non-dominant hand and let Opal know I'm going to take her oxygen off. And we're going to get ready to start. So I have my suction tubing here. You can test that with your thumb. You can attach this and test your suction inside this saline if you need to, but go ahead and lubricate the tip of your catheter. Okay, Opal, we're going to begin. So I'm going to insert this catheter without suction into the tracheostomy down until I meet resistance, and then pull back up just slightly, and go ahead and intermittent suction while turning the catheter for about 10 seconds, all the way up, clearing the secretions. And then if she needs to, you can reoxygenate her at this time, but you want to do that 3 to 5 times, or at least until the secretions are cleared and her breathing improves. And then of course oxygenate her in between if she needs to be reoxygenated, if her sats drop or she's in distress. So once you have suctioned her and you know that her secretions are clear, of course clean this out in between suction passes to make sure your catheter is clean. You can disconnect this. I'm not going to doff my sterile gloves for the video's sake, but you would take this off inside your sterile glove. I go ahead and pull her V-sponge at this time and take a look at that incision site and assess it, whether or not it shows any signs of infection or drainage, whether it's red or swollen, just to see how it looks, make sure that we're not having any signs of infection. So I would wrap these off in my gloves, throw these away. You can return her oxygen to her while you prep your next field. So there again, I would doff these gloves, throw all my stuff away, and wash my hands again. So wash your hands. I'm going to grab my suction care kit, my tracheostomy care kit, and then I would have another set of sterile gloves to get ready to put on. But you're going to open this sterile kit, just like you did the catheter kit, opening it away from you. And then at this point, I would open another package of sterile gloves and don those, and then start pulling out catheter care kit material. So opening my drape, minding that I have a 1-inch border around this drape that's considered unsterile. And these kits come with this inner box and some 4x4 or gauzes, hydrogen peroxide. I have Q-tips in here. I have little pipettes if I need, your trach cleaner, extra trach ties, and then it should have an extra V-sponge as well. So I will set all of these up. And then I also have another set of sterile saline in here. And so what you can do with this is open your hydrogen peroxide. You want to do a 50-50 mixture of hydrogen peroxide and normal saline in one of these canisters to clean your trach. And then empty the rest of your hydrogen peroxide in here for soaking to rinse it off. I'm going to throw this away. And then you want to go ahead and take your patient's oxygen off again. Let her know again, if she's not familiar with the procedure, what you're going to be doing so she knows what to expect. I'm going to contaminate one hand, which I already did when I took her oxygen off, and remove her cannula, this inner cannula. And you can drop that in your hydrogen peroxide and saline mixture. And you want to clean this inner cannula, being really, really careful that as you do this, you do not fling secretions and dirty material all over your sterile field. So some people do this down within the box. Some people like to do it over a trash can, as long as you're very conscious that you're not flinging secretions all over and contaminating your sterile field. So I'm going to scrub and scrub and scrub, make sure this cannula is nice and clean. Some tracheostomies come with disposable cannulas. You can throw those away and just place a new one in, and you won't have to do this step. Then soak that in regular normal saline, sterile normal saline. And then I want to grab that with my sterile hand, my clean hand, or sorry, sterile hand, the one that's not contaminated. Tap off your excess water, and then place that back into your patient's tracheostomy until you hear the click, just like that. And then you want to go ahead and clean around the stomal site and this flange if it needs to be cleaned. Do that with normal saline, unless for some reason she has crusty, hard secretions, and then you need to, you can use the hydrogen peroxide to loosen those up and get those off. So I'm going to wring out the excess saline here. And I did that with a contaminated hand. So I would throw those away and get new. soak those just with a sterile hand. I would probably go ahead and doff these and don a new pair of sterile gloves as well, just to make sure that I don't introduce any bacteria into her tracheostomy, since I did touch that with contaminated hands. So I would go ahead and clean. You want to clean off her flange. You can use the Q-tips then to clean around the incision site underneath the flange as well. So I would throw that away, get a new, clean, throw that away, probably get a Q-tip to clean very thoroughly around the incision site, make sure that it's clean, and throw that away. And then you would want to take some more sterile gauze and make sure that she's completely dry. Phalange, incision, all the skin around the tracheostomy is extremely dry before you put a V-sponge back in. So once I have her clean, I also want to assess whether or not I need to change these trach ties for her. Her trach ties are extremely clean. They don't have any drainage. They're not moist or wet. So I'm going to leave those on. But if you do decide to change your trach ties, which is always a good idea, make sure you have assistance. So have somebody come in and help you so they can hold that trach in place while you change ties. That's much easier than just doing it one-handed by yourself, but that is possible to do it on your own if needed. So her trach ties look really good. I'm going to leave them in place. They're extremely dry. They look clean. I didn't get them damp whenever I was cleaning. So I'm going to leave the trach ties that she has on in place. I would doff these sterile gloves, wash my hands again, and then I would don new sterile gloves a third time, and then get ready to replace her V-sponge. And so I have my V-sponge here. You have Q-tips, so you have those pipettes if you'd like, or I like to use sterile Kelly clamps to sort of help get this up through the top of the phalange and underneath the trach without sort of poking at my patient quite a bit. So if you have available sterile Kelly clamps, I like to use those as well. And we'll place this up underneath. You want to make this as sterile as you possibly can and as comfortable as you can for the patient. Here. So I have them up above the trach ties. I'm going to go ahead and sort of contaminate one hand just a bit just to pull this through. Here. And then keep this sterile, press this up, and then again with the contaminated hand, pull this up. So she has a new V-sponge. At this point in time, I would doff sterile gloves. I'm going to reapply her oxygen. If at any point during that procedure she needs oxygen because she's desatting or she's in distress, I would doff sterile gloves, apply her oxygen, and put on a new pair of sterile gloves and continue when she was ready. She did great with this procedure, so I would go ahead and clean up my mess, clean up my station here. I'm going to lower Opal back down to earth. I'm going to make sure her call light's in reach so that she has it. I also want to go ahead and listen to her lung sounds again, right? So we've suctioned her now. I've done trach care. I want to make sure that she's breathing much better, that her sats are better, that her vitals are better. And then I want to go document that I changed her V-sponge, that I provided trach care, that I suctioned her, if there were secretions that came out, what their characteristics were, and the amount of secretions that I obtained, and then how well she tolerated this procedure, because it's going to have to be done more than once. And that's it.